The Fisher & Paykel Healthcare Optiflow Junior 2 Blender Transition Kit was designed to allow transition to nasal high-flow therapy from bubble CPAP therapy, while being able to use your existing F&P bubble CPAP circuit. The Optiflow Junior 2 Blender Transition Kits are available in 5 sizes. Each Optiflow Junior 2 Blender Transition Kit contains an Optiflow Junior 2 nasal cannula, a circuit adapter enabling use of the cannula on the existing circuit, an Optiflow pressure relief manifold. This video will show you how to use the Optiflow Junior 2 Blender Transition Kit to transition to nasal high-flow therapy. Note: this demonstration is for illustrative purposes only. Please follow your hospital protocol when transitioning patients between therapies. Initial setup. Remove CPAP interface. Setup. Select appropriate cannula size. A visible gap should be seen around the prongs. In this instance, we have chosen the extra small cannula size. Open the Blender Transition Kit. Apply pressure relief. Remove the bubble CPAP pressure manifold with the white cap and connect the Optiflow pressure relief manifold with the blue cap to the inlet port of the humidification chamber. Connect the gas supply line to the Optiflow pressure relief manifold. Attach air or oxygen monitoring equipment as required. Refer to manufacturer's instructions for correct usage of monitoring equipment. Warning: ensure that the Optiflow pressure relief manifold with the blue cap is used for nasal high-flow therapy. Use of the incorrect pressure relief manifold may affect the delivered flow and could result in serious patient harm, for example, hypoxia. Connect cannula. Connect the adapter to the inspiratory limb of the breathing circuit. Connect the cannula to the adapter. Connect the system to the gas source and ensure there is a gas flow through the prongs. Remove and discard the expiratory limb of the circuit. Disconnect the expiratory heater wire adapter if in use. Warning: failure to disconnect the heater wire adapter from the expiratory limb may increase the risk of fire or burns. Flow rates. When using the Blender Transition Kits, you will not achieve the same flow rates as you would by connecting the Optiflow Junior 2 nasal cannula to the Optiflow Junior circuit range. Apply Optiflow Junior 2 nasal cannula. Prepare the patient's skin according to hospital protocol. Remove the first backing tabs from the F&P wiggle pads 2 and avoid touching the adhesive. Insert the cannula into the nares. Ensure the cannula bridge rests close to the nose without touching the septum. Do not stretch the cannula during the application. Stick the wiggle pads 2 to the patient's cheeks. Remove the second backing tabs and stick the wiggle pads 2 onto the cheeks. Important: always refer to the user instructions supplied with the product for full setup instructions, warnings, cautions, and contraindications. We hope you have enjoyed this short in-service video on the Fisher & Paykel Healthcare Optiflow Junior 2 Blender Transition Kits. Please contact your local representative for further information about these or any other Fisher & Paykel healthcare products or therapies, or visit www.fphcare.com.